and I have 11 o'clock, and we'll go ahead and get started. I do know we have some individuals out, and we'll be listening to the recording of the event because of the Thanksgiving week. So on behalf of our IHA, IRHA, and the State Office of Rural Health, we wish you a happy Thanksgiving. Hard to believe that we're celebrating already and things are still managed to be crazy across the state. We have three great presenters today, and Joyce Fillenworth is going to be kicking off. But before we do, I just want to make sure that everyone opens up their chat and feels comfortable chatting in any questions that they have, and we will make sure that they are addressed. If you hover at the bottom of your screen, it'll bring up a bar for you to select from. If you click the chat icon, it will open up the chat for you, as well as you can mute and unmute your line from that particular icon bar. And if you click on the participant list and pull up the list to the side, you can also mute and unmute beside your name by clicking on the little microphone button. And when it's red and highlighted, you're muted. So at this time, I'm going to turn it over to Joyce Fillenworth, the State Office of Rural Health Manager, to provide a little introduction and introduce our speakers for today. Joyce?
Thank you, Becky. Well, welcome everybody. So excited that you were able to join us today. Part of my position as a State Office Rural Health Manager, I feel, is really to be kind of your, do the legwork for you, to keep you informed of different organizations that are out there and services that they provide. So today, I'm so excited to present these three organizations. We've reached out to each other and had an opportunity to learn what they can offer your environment and the residents and the patients that you serve. So I'm sure you'll be very excited to hear what they have to say. Our first two speakers are going to be from the Indiana Recovery Network, Rebecca Gorell and Phil Stuckey. So I'll share with you a little bit about their background. Rebecca has been with the Mental Health of America of Indiana since 2016 and the manager of the Indiana Recovery Network since 2020. Rebecca is a person in recovery and has used her personal experience to help others reach their recovery goals. She is a certified addiction peer recovery coach too, as well as a trained youth peer support. In her free time, she enjoys spending time with her children, Bailey 7 and River 2, or binge watching Netflix. Then with her, we have Phil Stuckey. Phil is the executive director for Thrive, a recovery community organization that's based in Scott County, Indiana, and it oversees 21 counties in the southeast region of the state, including the overseeing of the reentry programs within multiple county jails, overdose response teams with law enforcement agencies, multiple emergency departments, numerous drug court communities, and the State Initiative Regional Recovery Hub program. And then we have Christine Hennessy. She is with an organization called Family Voices of Indiana, and she's the Family to Family Network Director. Family Voices Indiana is a federally designated health information center for the state of Indiana. Her tenure with this organization has afforded her the privilege and opportunity to represent the family perspective and the patient experience on numerous work groups, coalitions, and grant-funded research projects aimed at informing program initiative and development, professional training, and overall quality improvement for systems of care. Christine resides in Johnson County with her husband, 2 sons, and 2 dogs. Free time is spent gardening, playing soccer, watching her kids grow in their varying activities, and seeking new opportunities for creative expression. And I encourage you, while she's speaking, is to check out her office chair. It is awesome. She got it on Amazon, but it is, so kind of when you're talking, Christine, I kind of see those sassy black and white, it is an awesome chair. So check it out. And then last, we have Nicole Goldsborough. She's with the American Lung Association and is their national manager of the lung disease programs. Nicole has been at the American Lung Association for over 9 years and in the role as national manager for the past 4 years. During her time at the Lung Association, Nicole has led many lung health projects for the organization. She oversees the Reaching Rural Providers Initiative, which focuses on increasing COPD educational opportunities for rural health providers. And I don't know if you call or not, but I've sent out a couple emails blasts to all of you about those programs, because I know everyone's always looking for those continuing credits, especially those that are free, and she has opportunities for you to be able to do that. And she does hold a Bachelor of Science from Penn State University. So welcome everybody, and I'll turn it back over to Becky.
Okay, I think we're ready to begin with our presentation. So Phil and Rebecca, just take it away.
Good morning, everyone, and thank you for allowing us to present today. My name is Rebecca Gurrell, and I'm the manager of the Indiana Recovery Network. The Indiana Recovery Network is a program of Mental Health America of Indiana. And we are also supported by the Indiana Addictions Issues Coalition, which is also a program of Mental Health America of Indiana. And today we're just going to be talking about the Regional Recovery Hub program and statewide peer supports. So just a little bit about the Indiana Recovery Network. So we view ourselves as Indiana's recovery hub. So we are where recovery lives. Treatment is an important part of recovery, but recovery and recovery resources is how someone sustains their long-term recovery goals. We work to remove barriers to accessing recovery supports and services. So we want to make sure that recovery services are accessible to all individuals, no matter where they are on their walk of life. We have over 80 member organizations, and all of these organizations are recovery, not all of them, half of them are recovery community organizations, but all of them are focused on recovery and offer free services to the community. On our website, all of our resources are organized by SAMHSA's 4 dimensions of recovery, so health, home, purpose, and community. And all searches can be done by city or zip code when looking for resources. Here's a screenshot of our website. So if you go to the top bar where it says resources, that'll pull down the menu where it has the 4 dimensions of recovery: health, home, purpose, and community. And there's also a tab there for the regional recovery hubs, which we'll get into more in just a few slides. On our website, you can also click the button right there that says connect to a peer. When you click on that button, you are taken to a form that is both in English and Spanish, and the individual can fill out the form and they will be connected to a recovery support person within 24 hours. We also have up there at that top tab of the website, the recovery organizations, and that's where you can go in and do your searches by city or zip. And services on there can include recovery housing, treatment centers, or recovery community organizations that provide that community-based support. So recovery supports are vital components to the continuum of care. As I mentioned before, recovery is the long-term journey of someone's health. So most oftentimes when someone goes to a treatment center, they're given 30, 60, or 90 days to stay in that treatment center, which is great, but that's obviously not long enough to deal with a chronic health condition. So when someone leaves treatment, then that's where recovery comes in, and that's how we sustain and meet those goals. So recovery supports are vital to a person-centered approach. So when we are working with individuals who are on their recovery journey, we're not just treating those acute symptoms, we are treating the whole person, their mental health, their physical health. Do they have a safe place to sleep? Do they have food to eat? All of those things. Recovery supports also can help individuals access and navigate the different systems, because recovery supports are individuals who have experienced this themselves, so they know how things work and they can help guide that person on their recovery journey. So on this slide, there are some different points about certified peer supports. So they can assist individuals and families on their recovery journey. As I mentioned before, these individuals do have lived experience. Recovery coaches can provide hope and understanding while holding the recovery accountable in a non-punitive way. So we're not going to punish them or kick them out of our program because life happens. We're there to support that individual on their recovery journey, no matter what happens along the way. Recovery supports can be complementary to treatment, but they do not provide clinical services. So when you're providing a peer support, that's what you are. You are a peer to that individual. You're on the same level. You're not providing therapy and counseling. You're helping the individual to reach their goals and supporting them along the way. In our state, we have the Certified Addiction Peer Recovery Coach Level 1 and Level 2. Level 1 is recognized statewide and Level 2 is recognized nationally. We also have community health workers and certified recovery specialists, and those are recognized across our state, but they are not recognized nationally. So now we get to go into the fun part, the Indiana Regional Recovery Hubs. So the recovery hubs were started in support with support from the Division of Mental Health and Addiction and the Governor's Office Next Level Recovery. It all started at the beginning of the COVID-19 pandemic. So all of the restrictions were put in place last year. Individuals were cut off from their services and they didn't have any connection. We were told to isolate, social distance, stay away, and that is the exact opposite of what people in recovery need. They need that connection. Systems were overwhelmed due to the increased needs for resources and other services during the pandemic. The focus was all on the pandemic and everything else was kind of, put on the back burner. And so the state saw a concern for our most vulnerable Hoosiers. So those experiencing substance use and mental health concerns, those experiencing homelessness, those who were losing their jobs due to the pandemic. So there were a lot of things, and the state wanted to make a difference. So we started the regional recovery hubs. All of our hubs are recovery organizations. So we've got recovery community organizations, which provide grassroots support, community-based support, and they know the services that are available in those communities because that's where they live. They know what's available. We also have recovery engagement centers and drop-in centers, which both allow individuals to come into their center and meet with their recovery coach, hang out, have a cup of coffee, maybe read a book, maybe use a computer, and it's just a safe place for them to be during the day. We also have recovery cafes, and recovery cafes, their model is everyone deserves to be loved and everyone is recovering from something. And it's not just substance use or mental health, but maybe it's grief, maybe it's a divorce. They believe that everyone is recovering from something. And so we have several recovery cafes as a part of the Recovery Hub project. We also have recovery community centers and recovery coalitions. Recovery coalitions are statewide organizations that advocate for policy change, but they also provide peer support as well. So the purpose of the Recovery Hub project, like I mentioned before, was to provide services and support to those marginalized communities. It also helped to mobilize the peer workforce. So as organizations and centers were shutting down, peer supports were losing their jobs. And so by creating the Recovery Hub project and allowing individuals to work remotely and still engage with services, we were able to help these individuals maintain their jobs as well. All of our hubs, as I mentioned before, do have a critical relationship with their community members and community partners. So they're well known in their areas where they operate, and they're trusted. Our recovery hubs cover all 92 counties, and all of the services provided by the recovery hubs are 100% free. They are an access point for the community, so anybody can walk in the doors and they will help guide them to the resources that they need. It is for both mental health and substance use concerns, so we view it as one and the same, and we don't view it as siloed. And it's for the full continuum of the recovery journey, not just the acute treatment part. Hubs can also provide support to individuals pre and post-treatment. And we've also encouraged our hubs to create memorandums of understanding, or MOUs, and contracts with other community resources such as hospitals, justice, community corrections, community centers, food pantries, etc. And so as I mentioned before, it's a community-based model. Everybody gets their own individualized recovery plan using strengths-based. So that way, an individual comes in and says, I'm doing really well in this part of my life, but I need some help in this part of my life. And so we are there to help them on their individual plan. It's not a one size fits all, because that's just not how recovery works. And recovery coaches are independent brokers of resources. So no one is tied to one specific treatment center. If a person lives in Allen County and they connect with their recovery coach in that county, but then they decide to move down to Scott County, then the recovery coach does a warm handoff with another coach that's in Scott County so that no one gets lost in the gaps. This is the map of coverage. And as you can see, we have 20 different organizations on this map. And again, they cover all 92 counties, and all services are provided 100% free of charge. I do want to note that from April of 2020, when this program started, until October of this year, we have provided nearly 60,000 services across the state. And so these services include direct peer support, group peer support, referrals, connections with food pantries, hospitals, jails, Department of Corrections, anything and everything in between, DCS, anything you can think of. Our hubs have likely connected with those resources. And just to vet it a little more, I'm going to invite Phil Stuckey to share his experience of being a part of the Regional Recovery Hub program and how he has started working with rural hospitals in his county.
Hey, good afternoon, everybody. Can you hear me okay? Yeah.
Yes.
Good. All right. So I just want to give a little bit of background on some of the things we've been able to.
Hi. Good. How are you guys?
Some of the things we've been able to do since the Regional Recovery Hub program was started and put out the initiative. We have partnered up and created MOUs with 3 different hospitals throughout the state of Indiana. On how that looks is we're also in the emergency department, usually as an on-call basis. So if somebody has somebody that comes in not only with an overdose, sepsis, or anything, even if someone just comes in and asks for help with substance use disorder or mental health, we can be called in, and we have a pretty good response time of less than 20 minutes. Some of the hospitals we've actually partnered with, and we have people there on staff, for a few hours out of the day or week, depending on exactly what the needs are of the hospital. We have an overdose response team that we were able to implement, working with first responders and the ED departments, completely voluntary program. So if someone says they want help, they call in one of our coaches. We're partnering with another hospital looking to do some work in their ED department and with their OBGYN to work with postpartum up to 2 years. One thing that Rebecca forgot to mention, and it's the biggest hook that I can think of, is that all of our services are 100% free. We don't collect any insurance information. We don't collect any copays. Everything we do is 100% covered. So we don't ask for any financial pieces for any of our recoveries. We've also partnered with 2 different local hospitals. And I'm proud to say in the second week of December, we'll actually be putting in Narcan vending machines into the Southern Indiana hospitals. Really, that's partnered with ODL, Overdose Lifeline, to place free Narcan vending machines in there to help reduce the stigma and access to a life-saving support. Some of the other things that we've been able to do, working with them, we've partnered with another hospital where we are actually doing MAT induction through telehealth. So what that looks like, if you have, some hospitals have outpatient services. And so if they're, a lot of their EDs are also doing inpatient or induction to MAT medication. And so what we're actually doing is we're going to the recovery's house and we're taking a tablet and we're giving them headphones and putting them in a HIPAA compliant environment. And we're actually allowing the provider to see the recovery, do their initial consultation, because as you all know, with COVID, it's no longer, one of the barriers was that your first visit and your assessment had to be in person. And they've waived that. And we're very happy to know that they actually continued that through COVID. And so we're actually having somebody out there that's being able to help support that person through that experience, and able to, get that induction started, even if they need transportation to go pick up the medication. We're also available with that induction to where we can help that client through that process of induction as well. That's just a few pieces we've done. Like I said, we're also working with a few other ED departments to where if they're initiating MAT medication, they're calling in a recovery coach in with them to kind of help also make sure that they're getting access, and they're staying in touch to find a long-term provider. But that's just a few of the things that we've been able to do since we've started with the Indiana Recovery Network at DMHA.
Thank you so much, Bill. For those that do not have chat open, the question did come up, how long do you support the patient? And Rebecca did respond that IRN supports the individual as long as they would like. There are no time constraints. So I wanted to share that.
Thank you, Becky. And then we just have a few more slides to go over. So Phil and Scott County Thrive is also another partner with us on our 211 initiative. So our regional recovery hub peer supports are available through 211. You call 211, put in your zip code, follow the prompts, press option 6, and you get connected to a peer recovery support service immediately. Our peers are available 7 days a week from 9 a.m. to 8 p.m. And we are super excited to announce that we're going to be expanding to 24-hour availability in the very near future. I'm just not allowed to say the date yet, but it's very, very, very near. Our peer supports are trained on how to access and route individuals to all resources available in 211. And another really awesome part about our partnership with 211 is that, again, there are no time constraints placed on our 211 calls either. So an individual can call in, and oftentimes when you call 211, they have a quick turnaround. They need to get you off the phone within 15 minutes. But with our peer supports, there is no time limit. If someone calls in and they need a full recovery coaching session that takes an hour, then our coaches will stay on the line with them that entire time. Phil, do you have anything you want to share about 211, or you want me to just keep going?
Oh, please, you're doing great. Keep going.
And then another way to connect to our peer supports through the Indiana Regional Recovery Hub is through our app. So it is called the IRN Peer app. It is available for Apple and Android devices. And it's a quick way to connect with a peer recovery support within just a simple text. So Phil and his team down in Southern Indiana have done a great job of opening up these chat bubbles, and they get a lot of referrals through the app as well. So when you download the app, you click on it, you tap on a chat bubble and you send a message, and a person on the other end is going to be a certified peer support. They will respond to you. And this is a really great way to do things anonymously, because oftentimes in small rural communities, someone might not want to go to the local treatment center or to the local recovery organization, because what if someone sees their car there? What if someone from work sees them there? What if someone from school sees them there? There's a lot of shame and stigma attached to substance use and mental health concerns. So this way, individuals can get connected in an anonymous way and still get the support that they need. Phil, do you have anything you want to add about the app? I know you guys love it down there.
Yeah, I just think one great thing about the app, not only because you can completely start, like she said, an anonymous account without putting any personal information in there. Reach out to, and the cool thing is that when you reach out, only a certified coach can respond. So it's not like a message board where more people can kind of open forum where people can just chat back and forth. It's really just to get access and to help remove any barriers that people have while staying anonymous. And to me, that's one of the coolest things about this app is that you can reach out at any point to get any connection to resources.
Thank you, Phil. And this last slide just has some contact information. So Heather Rodriguez is the director of the Indiana Recovery Network. Again, I'm the manager of the Indiana Recovery Network, and Sean McDonough is our project coordinator. I believe Becky has Phil's email if you want to send that out to, if anybody has any questions for Phil as well. And thank you all so much for listening to our presentation.
Thank you so much, Rebecca and Phil. And so we will switch over now to Family Voices. So Christine? And we can see your slides just fine. Christine, are you unmuted?
No, I sure wasn't. Thank you.
There you go.
So I want to start with just the disclaimer that we're at a very interesting time as an organization. In September, Family Voices and About Special Kids announced their plans to merge. So we are in the process of a merger that takes full effect January 1. So I did put this presentation together mindfully in terms of incorporating programming from both organizations. However, we are in the process of learning what our new name will be, as well as contacts. So the contact information shared is available and will continue to be available, as will all the services that I talk about today. But if you see that it's kind of a generic title, that's why. So just to kind of get started, we are the designated F2F and P2P for the state of Indiana. What that means is that we are a family-to-family organization. We are HRSA identified as the Indiana Health Information Center. Every state and territory in the US has an F2F granted by HRSA. So we are part of a larger national network of family organizations designated to help residents of our state with any special healthcare need for children. The P2P is the acronym for parent to parent, which is a similar affiliation that represents just the fact that we are parents that have lived experience and are able to then provide support in that kind of peer-to-peer model. So as we talk about our organization, it's important to know where we're coming from and where we're going. Our vision is a world in which children and youth who require additional health and educational support thrive. So with that, really what we're trying to accomplish is through the power of our own lived experiences and shared experience, we support families that are raising children or youth who require additional health or educational assistance. We do that by providing answers, resources, practical training, and vital community connections, and also by advising the professionals who are serving these children and families. So when we talk about lived experience, to give a little bit more in-depth description, we are professionals with formal background, formal training, education in various different fields prior to joining our organization and doing the work that we do now. It just so happens that we are also family members of a child or youth that has a special health care need. So we have both the professional ability to do the work that we do and also then the lived experience to inform what work we do, how we do that work, and how we can best support families as they navigate very complex, sometimes systems of care. So we've dedicated our work to improving that access to information. We've experienced a new diagnosis. We've experienced the decisions over which medication should my child take and what's the risk for treatment and what's that going to mean long-term. What are the hard decisions that we have to make when it comes to testing, when it comes to treatment? We also know about the barriers to care. We know about it from a cultural perspective. We know about it from a personal perspective, observation of what it does to our children and how they perceive the treatment that they're getting. So for that reason, we feel like we have expertise that can't be found in a clinical setting or a school setting because we're allowed to talk about it in a different way. We have the ability to problem solve and support anyone who's receiving services from us, just in a way that if you haven't had direct experience, making those hard decisions is a little bit more difficult to process. So just to kind of drive it home, we've lived that difficulty of these decisions that have lifelong effects on our children. And we know that for better or worse, our children will be living with the decisions that we make for and with them. So we understand the gravity of every decision that that parent, that caregiver may have to make. So when we talk about serving, I mentioned professionals, families, But to be a little bit more specific and to talk about how we define a child or youth with a need. We look to the federal definition because we know that all children at some point in life experience some kind of medical need, maybe some kind of help with school. So this is kind of a more specific level of care, level of need. So directly from the CDC, it talks about nearly 1 out of every 5 children in the US has a special healthcare need. Children with special healthcare needs, also known as children that require more care for their physical, developmental, behavioral, or emotional differences than their typically developing peers. A special healthcare need could include physical, intellectual, or developmental disabilities, could also include longstanding medical conditions such as asthma, diabetes, a blood disorder, muscular dystrophy. And I'll add to that even, when we talk about children who are in a diagnostic process but don't have a diagnosis. So maybe there isn't a way to really categorize what's going on with them. We just know that it's significantly more than you would expect of a typically developing child. So when we talk about supporting families, we're talking about giving them connections, giving them support, and then elevating their ability to advocate, to work through not only their own struggles or barriers to care, but then to learn how to be that person for someone else. So we know that when it comes to caring for children that have additional needs, it can often be isolating. There's research and studies that we've participated in as well as read up on that confirm that it's different when you have to make decisions that people don't understand and that don't seem to align with the societal norm. So what we do is we speak with families, we listen to their story, we give them the time and the ability to have a safe space to share, to talk about what they need and recognize from our lens that they may not know what they need. So sometimes it's just a matter of helping them walk through where they are currently so that then they can start looking at things in a way of, what is the immediate need? What do I need in the future? What are my hopes and fears for my child? And then also, what are the child's hopes and fears? Ultimately, our goal is that children grow to be healthy, to, like I mentioned, to thrive. And to do that, they have to be a part of their care. And so how can we help the family experience to really connect both internally and then grow their network of peers and of supports externally? We provide support based on what's shared. For the families that don't really know what they want or what they need, sometimes we may give them information to help make a more informed decision or to prioritize what their starting point might be. Ultimately, our hope is that our work results in the family becoming more capable and confident so that they can make informed decisions based on what's best for their own family. We are very clear with families and with everyone that we share that our role is not to tell them what to do, tell them what to choose or how they should handle something, but to give them the information so that they can apply it to their own situation and make the decision that they're going to be most comfortable with. And then finally, when we talk about elevating families, it's really an opportunity for families to learn more, to kind of do that deeper dive of how can they get more involved, either in advocacy, in systems of care, maybe just becoming a family leader and leading a support group or a discussion group. There are opportunities all the time for advocating for systems change. Sometimes that's via response to something that's open for public comment at a legislative level. Sometimes it's just sharing their story with community members that may be able to influence, how that community views the current situation. So we also offer opportunities then with that to share their story for a specific purpose. And we actually do offer that as a training. It's very easy sometimes to tell your journey, but when you're trying to tell it for a specific reason, additional training can really help isolate what you're trying to say in a way that you can be heard. Ultimately, experience-based means we are families serving other families. Our team members, for the most part, started out by reaching out for some kind of support, finding themselves in a situation where they needed the services that we had to offer and then felt like they had a calling and ability to join our team and share for other families. When we talk about supporting individuals, there's several different ways that we look at it. It's like I mentioned, identifying or prioritizing needs, access to resources. Sometimes those resources could be fact sheets that we offer on our website. Sometimes it's looking at eligibility for different funding programs, Social Security waivers, things like that. Sometimes it's help understanding how to apply for a specific program, how to understand what the eligibility requirements are, and then what I need in order to be able to apply. I mentioned networking with families and safe spaces. We offer remote and virtual support. So we serve the state of Indiana. Our services are free of charge. There is no cost to a family. And we are able to do that in a way that meets their needs. So we have social media presence, pretty strong one. We offer email referrals, phone referrals. We've connected with families at transition fairs. Maybe they're seeking information and we have an opportunity to share what we do so that they can learn a little bit more. Maybe it's about things that they didn't know existed and they thought, you know, they had everything that they needed, but when they find that insurance won't cover something, they might circle back to us to say, how can I get this paid for? What else is out there? We offer training for families, like I mentioned, and advocacy support. We do also look to advocate at a legislative level when possible. We represent the family experience on several work groups so that as professionals are developing programs or doing maybe just quality reviews, they're really thinking about things through the lens of the family and what that means for that family. And then with that, we also seek and love opportunities to be able to collaborate with others. And again, either share and represent the family experience or get families involved. So if family leaders have done the training and have interest in being part of these partnerships, sometimes it's a perfect opportunity to really connect and let a different family member tell their story in a different way. We also look at the needs for diversity and inclusion. We recognize there's a growing need to be more aware and accessible to a larger, more diverse population. We're constantly looking at evaluating our materials for literacy, not just in language and simplicity of the writing, but also in accessibility in terms of, is it visually engaging? Are there translations? So we do offer all of our services in both English and Spanish. We do have a bilingual, bicultural specialist on staff. We also facilitate GALA, which is a support group specifically for families that are Spanish speaker with autism diagnosis for a family member. We have a Facebook page specifically dedicated to Spanish speakers, as well as all our print materials, fact sheets are translated. We also offer an English for a specific purpose training. So similarly, it's one thing to know the language and it's another thing to understand the language when we're talking the medical complexities and discussing medical needs with a provider. So we offer the ability for Spanish speakers to really dive in there. We offer translation support for other languages via just networking and community partners. We found that often medical providers may contact us for support for one of their patients, knowing that there's a language barrier. We work to identify a time when the family will be at the medical center with a translator that we can then schedule a conversation so that we can share information and that it can be shared back to the family in their native language. We're constantly looking for opportunities to expand our offerings for translation as well, noting that there are quite a few populations in our state that don't have access to the care that they need because they don't know it exists. And so if they don't know how to get to that medical center for translation, or they don't know that they have a right to have a translator, those can be big barriers that we're always looking for ways to bridge. And then again, just enlisting the help of different community partners to find the language support. We found resources that offer translation free or at low cost. We've sought funding opportunities for additional translation support. So really, we're constantly looking at how can we engage other organizations and become a partnership there. One of the things specific to the rural healthcare and population and more with the COVID pandemic, we were able to receive funding through the CARES Act that enabled us to complete a telehealth project where we were able to share in both English and Spanish what telehealth is, the ins and outs, kind of the nuts and bolts of how telehealth works. And then to take it a step further, we were able to sponsor several families for 6 months, providing them with internet service at no charge to them so that they could have medical support within their home. We found that driving to McDonald's, as obvious probably, and sitting in the parking lot borrowing the internet is not an effective way to get quality care. So we really wanted to make sure that families had access in a way that they could create an environment that would be conducive to a quality appointment. For some families, we found that their telehealth was being completed maybe on a prepaid phone or something that wasn't really incredibly reliable. So we were also able to use that funding then to purchase tablets for some families to be able to have not only the access to the Wi-Fi, but then a device that would be able to help meet that need for a good appointment. In terms of serving professionals, we do offer technical assistance, partnership opportunities. We offer professional training as well. And we're able to advocate in partnership and help providers to really understand what it's like to be the family member making a decision. You know, let's change the talk from the non-compliant family to what's happening that they're not getting to their appointments. Is transportation a barrier? Is it the access to telemedicine? Is it a childcare issue for another child, especially in days where we're not allowed to bring other family members to an appointment? It's specifically the patient and the caregiver. So we found that as professionals become more familiar with our work, they're more willing to give our information to families as an additional resource. I think it's kind of the buy-in of just when you learn and you see the success that we're able to help families find, it's a little bit more comforting to be able to share as a resource. We work with all different professionals, medical professionals, doctors, nurses, social workers, school faculty, and other community partners. So our hope and our vision is really to reach as many people as possible and share who we are and what we do. But we do also help professionals on a one-on-one basis if they call and have a need for support to understand how to maybe better work with a patient, or maybe specifically what resources can that patient access that maybe they don't know about. So when we say technical assistance, it's really partnering with the professionals for the same children and youth that we're caring for. How do we support them when they're referred? We give them common need to know resources and then share with them best practice for referrals, which I'll get to in a minute. With partnerships, again, just looking for different opportunities to improve systems of care. Right now, we're involved in a complex care partnership. We're in year 5, where we've been working on care coordination and medical home and what that looks like, how those systems can improve, and then ultimately how we can streamline the access to care so that families aren't pulled in, so many different directions regarding trying to remember appointments, remember what they're supposed to do from one to the next. Are the providers communicating? Is anyone really looking at all of the medication the child is taking and how those things interact with each other? And just a way to get more support within practices so that primary care physicians or other physicians aren't as concerned with taking on complex care kiddos. Within our trainings, we have things that incorporate support for families and also the at a professional level in terms of learning about the family experience and learning what support can look like. They've got the medical training, the formal training, and kind of the textbook approach, but that doesn't always work. And so we work to help families have that, or professionals to have those experiences, and then ultimately help them identify the ability to advocate as well. They have experiences of their own in caring for these children and have platforms that we don't. when it comes to informing systems of care and making changes, even small, within their practice. So we work to help recognize trends and support needs. We help them communicate with families in terms of how they can help and how they can build trust with a family to really give quality care and understand from a more, probably a more foundational level of why a family might be making the decision or taking action in the way that they are or are not. So when we talk about getting involved in terms of referrals, our philosophy is to meet families where they are. Often we encourage that the best experience would be when the family contacts us directly. We're able to ask questions and kind of identify what the kind of underlying need is. And in that way, partner that family with a resource specialist who has that similar lived experience and knowledge. So all of our team is widely trained and has an understanding of how the systems work. But if we have a mom call us with a brand new diagnosis of autism, it might be best to talk to someone who's lived that specifically and dealt with the ABA process and then transitioned to school. So we really try and look at what's going to be the most ideal match to give support and in a way that families need. So we have families that contact us through our social media platforms asking for more information and one-on-one discussion. We get the traditional phone calls, we get emails, opportunities via our website. We do have on occasion, providers will call us and ask us to help a family. And typically we provide the support and the preliminary information and then ask the provider, is there a time that we could all talk together to really get to know the family and build that trust to help them. So we have resources online. Some families just want the materials in front of them or want to be able to read the information on their own. We offer about 65 fact sheets that are maybe 1 or 2 page quick hit information in a little bit more simplified way. And then we have some more in-depth resource guides and information packets that are more kind of that deeper dive of information to really dig through and search. We always welcome opportunities to support anyone that's caring for these children and youth. So it's not always a family member. It may at times be a sibling. It may be a grandparent or an adoptive parent. So we really look at how can we approach this as a whole child experience, regardless of who the caregiver is. And in terms of getting involved, I mentioned before, all of our services are free for families. So we are a nonprofit organization. Our work is funded through grants such as HRSA, also Title V. We receive sponsorships and donations as well as community partnerships and give back programs. We have a current one with Walgreens as well as Kroger, Amazon Smile, and others. We have several fundraisers throughout the year. Some are more of we receive proceeds, dying to donate. Others are our Founders Breakfast, which is always in October. And then the month prior, we always do a conference every year that's virtual and will be virtual again next year, where we have opportunities for exhibitors, sponsorships, and whatnot, so that we can offer that full day of training for free. So we also note that support isn't always monetary. Sometimes it includes opportunities for volunteering, mentors, families that have walked this experience and don't necessarily need the employment, but want to be able to help a family that's newly experiencing these needs. We have community champions. We welcome internships. Really, if someone approaches us and says they want to get involved, we'll find a way to make sure that they can get involved. And finally, we have board participation as well. So we do have a volunteer board that's comprised of quite a wealth of knowledge in different professional capacities. But our board also has representation of caregivers that are able to offer insight and give input similarly through that lived experience. So if anyone does want to connect or learn more, we're all over social media. There's also, access to our website, email, phone, and I'm sure, Becky, that if you shared these slides, they're available, and I'd be happy to throw my email in the chat as well.
Perfect. Thank you. I think due to time, we'll go ahead and if you'll stop sharing and And Nicole, if you're able to share your screen so we can cover your information too from the American Lung Association.
Hi, everyone. Thank you so much for having me here today. As Joy said, my name is Nicole Goldsborough. I'm the national manager from the American Lung Association. And I'm here to talk today about one of our latest initiatives called the Reaching Rural Providers Initiative. Let's get this situated. All right, so a little bit about the program. We received a grant from the NHLBI's Learn More, Breathe Better program to build awareness of COPD in the rural communities. And really, we're looking to do that by targeting healthcare professionals. And healthcare professionals is really a broad spectrum of individuals. But our main focus is on healthcare providers like physicians, respiratory therapists, nurses, and social workers. And we're really looking to increase awareness and access of our COPD education, as well as patient-focused resources for those living with COPD or at risk of developing COPD. So taking a look at why we're focusing on COPD in rural communities, and this is from the National Heart, Lung, and Blood Institute's Learn More, Breathe Better program. And it's nearly 5 million people living in rural counties have been diagnosed with COPD. And the reality is that hundreds of thousands of people have it and don't know it. COPD is also about 2 times higher in rural communities than in other areas. So this is a really important public health concern. And our work is really focused, although we're a nationwide organization and our programs are available nationwide, through this project, we're putting an emphasis or an additional focus on 6 states, and Indiana is one of those states. So let's just talk very briefly about what COPD is. A lot of people, you might have heard it, but really just don't have a great grasp of what COPD is. So it is a serious lung condition that makes it hard for people to breathe over time. It's the 3rd leading cause of disease-related death across the country. And unfortunately, because a lot of times it's developed later in life, as you age, you think the shortness of breath or difficulty doing normal activities actually might be symptoms of COPD instead of, just getting older. So it's a really important condition, and we're encouraging healthcare professionals to learn more about it and talk to your patients if they're experiencing shortness of breath or symptoms of COPD. And so we know that there are different risk factors, and those living in rural communities do have a higher burden of COPD rates. So if you're a healthcare provider and you're serving rural communities, where do you find information about this project? And you can go to our landing page. It's lung.org/rural. And on that, you're going to see a lot of different resources that are available specific to providers, including our Ask, Advise, Refer, To Quit, Don't Switch, our courses, as well as patient education. And what's great about people who are living in or serving the communities within our 6 states is there's actually additional resources that are available to you that aren't available to our professionals nationwide. And so one of the things that I'm really excited to share is the patient education. So as part of this project, we are able to print and mail patient education directly to rural providers. I have 2 examples on this screen. The first one is my COPD action plan. We know that a lot of times patients who have COPD, when you get to the yellow zone where your COPD symptoms are worsening, there's often a lot of confusion about what to do next. Do you take your medicine? Do you call the doctor? Do you just wait it out? But having a plan of action really gives more opportunity for patients to understand what to do and to take kind of that ownership over having a lung disease and better understand how to manage. And we also have another handout that's really more popular. It's living with lung disease and the benefits of quitting. You know, with COPD, there's often patients who say, I'm still smoking. What's the point in me quitting with a lung disease? And the truth is there's a lot of benefit to quitting. And this is a really great educational tool and conversation piece for those patients who are still on the fence about quitting or just looking for more information about why it's important for them to quit, even with a lung disease. We also share the Learn More, Breathe Better program resources. They have a really great free toolkit, and we have a lot of their resources incorporated into our patient education materials. They're all really easy, colorful, and really just focus on helping patients better understand how to manage their lung disease. And also just great tools for providers to use as takeaways after a visit. So another part of this project is really to increase awareness of provider resources. There's a lot of trainings out there. However, there may not be a lot of trainings for COPD, as well as spirometry. The American Lung Association has a host of tools and resources that are available at no cost for providers. Just to highlight some of them, which is our Ask, Advise, Refer to Quit, Don't Switch. It's based on the CDC's Ask, Advise, Refer model for conducting effective tobacco intervention with patients using tobacco or vaping. We're encouraging them to quit, not switch to vaping products, as well as coaching videos on how to do spirometry. And also we have social media posts to really build awareness in November about why COPD matters to everyone. So just to kind of dive a little bit deeper into one of our courses that was developed specifically for this project, it's called the COPD Overview Course. It's actually, we pulled the top content from our 14-hour continuing educational course on COPD, our COPD educator course, which is 14 hours. So we pulled the top content and kind of developed a 1.5 hour presentation. It was moderated by a nurse practitioner who is in a rural community in North Dakota. And she gives a great perspective on kind of serving rural communities and helping providers better understand the kind of the guidelines-based care for COPD and management. It is CME approved as well as CEU approved for respiratory therapists, nurses, and you get a certificate of completion at the very end. So the American Lung Association, if anyone knows, we're a nationwide organization, and our mission is to improve lives or to save lives by improving lung health and preventing lung disease through research, awareness, and education. And so this piece about reaching rural providers to build awareness to COPD is just a piece of the work that we're doing. And so I encourage anyone who does work with patients living with lung disease or is interested in learning more about lung health to visit our website at lung.org. Where you will kind of get lost in the information that's available to help people understand how to better manage their lung condition, help patients better understand their lung disease, as well as find resources to help you connect with others. And so I don't know, I shared a lot in probably 9 minutes, but I will turn it back over to Becky and just kind of round us out for the rest of the day. So thank you.
Thanks, Nicole. Could you cover again exactly how a provider would request the free materials?
Sure, that's a great question. So you can go to lung.org/rural, or you're welcome to send me an email. I've actually gotten more requests just from email, thanks to Joyce's email to Indiana providers. I will say just this opportunity has kind of expanded a lot of our reach. And so my quick little plug is, if you do work, or since you do work in hospitals, sharing these resources and sharing what's available to providers would be greatly appreciated to increase access and awareness of what's available to providers, and it's free. So thank you again for the opportunity to kind of present today.
Yeah, and Indiana was definitely one of the targeted states because of the prevalence of COPD among our Hoosiers. So certainly important information to share. So that brings us to the top of the hour. I did receive a couple of questions, and we will send out those questions with the answers when we send the recording link to the event. If you have any other questions, though, feel free to reach out to me, Becky Royer, at BRoyer@IHA Connect, if you need the presentations from today or additional questions that come to mind after the session, and we will get those addressed for you. So thank you so much to our presenters today. I've received some comments back that this has been great information, and organizations that they really didn't quite understand how they might now be able to use. So appreciate you all just taking the time sharing your resources. And again, from the Indiana Hospital Association, the Rural Health Association, and the State Office of Rural Health, we want to wish everyone a wonderful but particularly safe Thanksgiving. So thank you, everyone. Have a wonderful day. Bye-bye.